Some spectacular jumps in generic drug prices were exposed in an article in the New England Journal of Medicine. Doxycycline, an antibiotic, went from 6 cents a pill to $3.36, an increase of more than 5,000%. Captopril, used for hypertension, increased 2,800%. Dr. Jon LaPook is looking into why.
Barbara Heller has an autoimmune disease called PBC. She takes the generic drug ursodiol to prevent liver damage.
The last refill that I got for ursodiol cost $94.50 for 3 months.
In August, she called for her usual 3-month renewal, expecting her cost would still be under $100.
Your price for this drug is $1,212.30.
I was upset. I didn't know what to do. I need ursodiol every day, probably for the rest of my life. Cost can't be a factor in not getting it.
A recent analysis found nearly 10% of generics more than doubled in price in the past year. Today's article points to the impact of less competition in the generic drug industry. For example, over the last decade, the number of companies making the heart drug digoxin fell from 8 to 3. And the drug price went up by 637%. Dr. Aaron Kesselheim of Brigham and Women's Hospital is one of the authors of the paper.
So without competition, the generic companies can say, what's the price, how much you got?
Yes, everybody just assumes that generic prices are low. But generic prices are low because there's competition. And so once that competition goes away for whatever reason, then you have very expensive generic drugs. And these can be very expensive for patients.
Well, this is 3 months worth. But
after Heller and her husband did extensive research, they were able to find the ursodiol at a discounted rate. But it was still more than 3 times what she had paid before.
The Generic Pharmaceutical Association points out that in 2013, generics saved the healthcare system $239 billion. The price hikes that threaten those kinds of savings are why a Senate subcommittee chaired by Bernie Sanders will hold a hearing next week.
Doctor, thank you very much.